Good morning, one and all. Dr. Z here with another episode of Tooth Teacher Tuesday. This week's Oral Pathology Corner focusing on a condition known as dens invaginatus. And what that long, funky phrase means is a condition where, as the name kind of implies, it's a condition where when a tooth has developed, it's developed this little infolding, this little crevice where instead of having a continuous tooth surface, the usually biting surface of the tooth has a little inward infolding or invagination, like the name suggests, where that doesn't have that continuous surface, but the tooth kind of has grown a little bit into itself. And with dens invaginatus, it's not an inherently problematic situation. You know, as you can imagine, anytime you've got a hole in a tooth, it's going to be hard to keep clean. This picture probably can give you a good appreciation of what it looks like. But, it is still a hole in the tooth, not a cavity or not a resorbed area like we've talked about in the past, but just an ingrowth of the tooth that, if left untreated, could cause issues. If it's caught early enough and is small enough, a lot of times that little infolding can just be filled in with some filling material and seal things off from future issues. But if that infolding is deep enough or is left untreated, either it's going to be almost impossible to clean and will develop into a cavity, or it may be just naturally developed deep enough where it's infolded into the nerve of the tooth, and at that point treatment's going to require a root canal to not only fill in that crevice in the tooth, but also to take care of the nerve that's been encroached on by this invagination. So it's something that, and we've talked a bit in the past, but a lot of developmental issues with teeth most frequently is going to be seen with not the very front upper teeth, but the two what we call lateral incisors that are on either side of the two front teeth. It's the most common area to see this. Can happen with any other tooth, but typically we see it there. And otherwise, like I said, the key is detecting it early to hopefully keep that hole from getting any bigger and creating bigger issues. And otherwise, pretty simple topic. So, hope you found this interesting. As always, if you're worried that you may have this, don't try to self-diagnose. Check with your dental professional and have a proper diagnosis made. Until next time, I want to thank you for your time and hope to see you on next week's Tooth Teacher Tuesday.